We'll see what happens. All right, looks like we're live. We'd like to welcome Dr. Gonsalves today. Gregg Gonsalves is an associate professor of epidemiology at the Yale School of Public Health. He's also an adjunct associate professor at Yale Law School and a visiting associate professor at Harvard Medical School. He's an epidemiologist that's focused on substance use and infectious diseases, also an expert in policy modeling on infectious disease and substance use, as well as the intersection of public policy and health equity. In the past, he's worked with non-governmental organizations for about 25 years or a little bit over in HIV and AIDS work, global health and human rights in the US and South Africa. And most recently, and what I know Gregg for the best in these recent times, is that he started a grassroots coalition, really, I think on LinkedIn, called Defend Public Health. And this was in response to the recent nomination of RFK Jr. to lead HHS. So, Gregg, thank you so much for coming to our podcast. And what we'd really like to do today is just ask you some questions so that we can get the information out about Defend Public Health for people to learn more about it and hopefully join in if they're interested. So I think the first thing we'd like to ask you is what motivated you to start this group, Defend Public Health?
Thanks, Amy and Tony, for having me. So it might have been the day after the election or a couple of days after, and I was in a panic, um, knowing what was going to befall us, and put a note out on both on LinkedIn, but on my Facebook page and on Blue Sky, and I said, "Hey, one of the things that I know from COVID is that a whole coalition of people, physicians, scientists, people who work in public policy, people who work for public health departments, arose to sort of deal with the mess that was the COVID response in the United States, both under Trump and under Biden." Excuse me. I also come from a background of ACT UP New York and organizing around HIV in the 80s and 90s, but also organizing for access to AIDS drugs globally in the 2000s, and sort of said, "Hey, everybody, we need to get together again." And there was a huge response. I was like, "Oh, a few friends will respond," but you know, now there's over 2,000, close to 200, 500 people who all around the country who are interested in doing something, and we spent most of November and December just trying to get ourselves together, and it was a bit clunky, but now we have over 2,000 people are interested in doing a variety of tasks to push back against Trump and Musk and their minions. So
That's great. Yeah, I think I follow you on LinkedIn and I saw that you put that call out on LinkedIn and it was to me exciting because I was thinking the same thing, but I don't have quite the following that I think that you do and some others do. So it was really nice to see that there was going to be some organization in some way, I think, to make a difference. Um,
A question real quick.
yeah,
How many people responded? Because I feel like I think that like a lot of us feel like we're in our own little echo chambers and that we're the only people who are like trying to figure out what to do about things. And we know that in general that's not true. But I'm just curious, like what was the response? Can you give like a number of people for like a ballpark number just so like folks can
so
get an understanding of
now there's about 2,500 people, like
that
totally
is across
respond
the country, across the
across
country?
the country, like from yes, from across the country. We have either people in every. I think Idaho might be the only state we don't have people in or contacts with. Um, some people from abroad. I mean, there's a set of people I know from the HIV response, but then there's people like I just met, like Amy and others, who have basically come out of the woodwork. Um,
Mhm.
you know, and it's a diverse bunch. It's like it's clinicians and scientists, but it's also patient advocates and retired federal employees and
Nice.
lawyers. So it's a nice mix.
Very good. That's exciting. That's exciting to hear. because a lot, I think in the circles that I'm in some of the circles that I'm in, people just feel like this is just happening. It's like, and there's no like, where's the resistance? That's a common question. Like, where's the resistance? Where can we join? And it's good to know that something like this is going on.
Yeah, so I think along those lines, Gregg, would you mind just letting people know how can they get involved in this work? And I know that we have monthly meetings and that there are several different committees. Like as an example, I'm on the communications committee. But like, what would be the best way for people to join this resistance, this Defend Public Health group, and then share their expertise in ways that would make all of us feel like we're doing something, but also move the needle forward for defending?
So we are all volunteers, right? So it's a little bit ragtaggy. I have a link if you could share it with your listeners. I'll put it in the chat or send it to Amy and Tony afterwards. But it's a link to a Google form which we're importing into MailChimp, which we're sending out newsletters to people and telling action alerts, how to sign up for committees, et cetera, like that. So I can send you all those that information after the call.
Yeah, that would be great. I think that'd be helpful. I think I just recently joined the Google groups, and there's it looks like there's several ways for us to be involved, and like I said, multiple committees. So I guess what do you think what's the vision for the future of Defend Public Health? Like, what are some short and long-term goals? Because what I love about this is so many people are becoming involved and engaged. I don't envision this as being something for just 4 years. It seems like it would be something that would be beneficial to the world, to our nation, to continue beyond that. So, what do you see for the vision of this?
I don't know because we're 2,500 people coming from all different kinds of backgrounds, and um, you know my instinct is that we need to push back and push back hard against the Trump administration and their allies, and that some of our older and more venerable medical and public health institutions are less likely to do that because they get funding from the federal government, or just their whole vibe is a lot more sort of conservative. And so in the short term, I think we have the ability to maneuver and do things that others might not do in terms of speaking out and calling people to account. Um, you know, we got to get to these first few years of Trump first to think about the long haul. But I mean, outside of the concept of defend public health, um, a guy named Ed Yong, who wrote for The Atlantic during COVID, which many of you probably read his articles, wrote a piece shortly before he stopped writing altogether for them called How Public Health Took Part in Its Own Downfall, and said, we were in the 19th century, we were campaigners, right? The fact that we have, clean drinking water, we're not taking out our excrement in pans to the street and tossing it there, that we have clean air to build, that our buildings aren't filled with asbestos. All of that was done by people who saw public health as a campaigning issue. Like, it wasn't just about technical epidemiology or medicine. And so maybe we can get back to our roots as a public health family and try to figure out how do we, Americans were not that healthy before the pandemic, right? We were 44th in life expectancy, and so in the world. And so we got to get back to sort of the basics of public health that we maybe forgot about, over a century ago.
I love this. I think that one of the drums that I've been beating along with Amy when we're talking about these things is that we don't know how to talk to people. We don't know how to communicate. Everything has been very, like you said, technical, epidemiological. Like, the average American doesn't get what we're saying. We're not translating. And I think that, we had a previous guest, Evan Thornburg, who talked about, the gatekeeping in medicine and the gatekeeping in science, and like that's part of the downfall, right? Like, that's part of the issue, is that we're not engaging the public in its own health. And what has come out of that has been us, it's turned into an us against them type of situation where it's kind of like no one trusts us anymore. I think that we're just not reaching folks, and now we're in a situation where anything that we say is an indoctrinated, we are a part of the problem. We can't, we're just trying to push these poisons on folks, like it's just we're not even seen as folks that are genuinely trying to help anymore. It's like we're genuinely trying to hurt, like it's an active process. And so yeah, I think that we, along with maybe getting back to our roots, just kind of uplifting those roots and starting anew as to like a new strategy, a new way to try to connect with people, really helping folks come along the information that we're getting and understanding that, what, we're not omnipotent. We don't have all of the answers. We're not 100%, correct all the time, but that's what science is. It's learning and doing things at the time with the information that we have, because we're trying to save your life today, and hopefully for the future. So I love
I
that.
mean, I think that's great. It's like a couple of things. One is like remember like the distrust in public health is also manufactured. Like the right wing has spent a lot of money to shift the narrative during COVID to to basically make public health the enemy. Yes, public health didn't do everything right, etc. But you know, Moms for Liberty and other groups were really fanning out across the country to put doubt in people's mind about public health interventions, etc. The one interesting thing, Amy said that I've worked in South Africa, and during the old days of the Thabo Mbeki regime, when they said HIV wasn't the cause of AIDS and antiretrovirals were poison, this group called Treatment Action Campaign said, we're going to take scientific information, we're going to translate it for the people, right? And so across the country, people in townships with maybe a primary education, maybe not, were learning about the HIV viral life cycle and, what a T cell was and what a macrophage was, and what opportunistic infections were, why the drugs weren't available to them across the country. And, really, as you said, Tony, translated knowledge that was complicated in simple terms, that built a movement there and was able to topple, Tabo's regime and build the largest HIV treatment program in the world. And so I do think there's a way to sort of use our knowledge, translate it to the grassroots, and build a movement based on sharing science and public health information in a way that's accessible to everybody.
That's exactly what I completely agree, and that's one of the things that I think has been maybe a downfall or something that we maybe don't get right in training, is that a lot of MDs and PhDs are not trained in science communication, PhDs in general. I know MDs like Tony, you talk to patients every day that don't have a background in science, so you get a little bit more experience. But when we go through training, we are encouraged to use all the jargon and to talk to colleagues and to publish behind paywalls and to put all of our science out in places where the general public can't access it. And even if they did, I mean, often the title of journal articles in itself is a barrier. Like a lot of the words that we use, even in titles, just are not. So one of the things that I've been doing at Anschutz is to work with faculty and trainees to be able to translate their science and put their science out on websites that are not behind a paywall, to encourage people to speak at bookstores and libraries and host webinars that anyone could get on, or all these different things that I think we don't do a good job at telling the public all of the amazing, wonderful things we do and the impact it has on their health. I think because we know that most of us, that what we're doing is to help people, but I don't know that like you were saying, there's a lot of people on the other side trying to really tell people that we're not doing things that are helpful. But I think we need to be better about telling people, like, look at what we're doing. Here are the things, here are the ways that we're impacting public health. Here are the ways that we're improving your lives. And I think we just need to add that to all of the things that we do. So anytime that you would have like some amazing revolutionary, or even just every day, helping people's public health, tell them about it in some way that's accessible. So I think that that is something we need to shift to doing more frequently and training people to do that. Like that has to be part of their everyday existence is to translate what they do and to tell the general public and have it be accessible. So absolutely. I mean, I would love for this Defend Public Health group to have something like that be part of the fabric of where we go and what we help people learn to do.
I say, why not? Like, we can just do it because, like, there's no structure. Like, you're on the communications committee. I mean, there's research institutions and clinical institutions all across the country. You know, if you got a clinician and an immunologist, for instance, to go out into the community and talk about vaccine preventable diseases or H5N1 in simple terms, you know, even if it was two people to go to a community health center or to a library, etc., um, it does a lot of good. Not to keep referring to HIV/AIDS, but in the old days, yes, during the 80s and 90s and 2000s, scientists would come to the LGBT community center in New York and would say, "Oh, this is the latest study on combination antiretroviral therapy or opportunistic infection." The same thing in South Africa. Um, Researchers would write articles for the newsletters for community organizations. There's a template for this all over the place, right? Like it's not rocket science, but it's never told. We never told it's part of our jobs. And everybody's busy and hustling for grants and dealing with, the many patients that they're caring for in a given day. But if a couple of people from local institutions, went out into the community, it would do an amazing amount of good for community education and community goodwill.
Yeah, I agree. I think a lot of people are very motivated right now. There are a lot of like Substack articles, things like that. I think we need to, and those are amazing. I think we need to think about how do we get it out to the people because there are some people, a lot of people that need to read it that aren't going to go to Substack. They're not going to go to the articles that we put in the Conversation or the Nation or all these different things. Like I think how do we get to those people? I think that is, kind of the billion-dollar question, right?
You go to where the people are, right? Like, like not no disrespect to Substack or the Nation or the New York Times or anything else. It's like that's not where the people are, right?
Right.
Maybe we can get into these right wing echo chambers and have conversations there. But again, like in Denver, in New York and other places, you could just go directly to people unmediated by a publication. Everybody's like, wants to write and thinks that's going to necessarily get to people. But, again, the direct touch, the face-to-face conversation is probably more important to gaining people's trust than, sharing a link to this or that.
Yeah. 100%. I think that one of the ways is using, uplifting community health workers, community-based organizations, going into those spaces where the folks are. I think that when you're having that face-to-face conversation, that they can look you in the eye, and it takes a couple. It's not going to be like the first conversation, right? Like it's going to be one, maybe it'll take 7, 8 times that you've talked to somebody. But it's that commitment that is required in order for us to start changing folks. And I think, I think one of the things that I see, I do, even though I do work in public health and I also see patients, but one of the things that really touched me was one of my patients. I think I mentioned it to Amy last time we chatted on the podcast. I had this woman who came in with her 2 kids for a well child check, and her 2-year-old was fully vaccinated, like needed probably just like maybe one other shot to get up completely updated, and her infant wasn't yet. Like they had been a little bit behind, and she was taken up by RFK Jr. And she was like, this is, she said, I'm no longer vaccinating my children. I really highly respect what this man has to say. And I tried to engage as much as I could, like I just kind of, your dog is adorable. I tried to engage her as much as I could. and tried to talk to her and said, okay, well, show me, what are you looking at? And it's just these very, actually, it's not even very sophisticatedly, like, edited clips, right? Like they're just these horrifying clips of like piecemealed conversations that impact folks, that tug at the heartstrings, that get the emotions going, this person's just trying to protect her kids. Like she's just trying to do the best she can to make sure her children stay alive, and has been convinced by this person who has a very strong name in the nation that that she's going to actively hurt her babies if she puts this substance into their arm, and so it's just they've done a really great job. I think we talked about this a little bit too, Amy, like at some point where we're just like the anti-vax machine, that has just been ever present, has just been so strong. And I think that one of the things that helped us create this podcast was our colleagues were very much like, we're not going to give this any airtime. We're not going to talk about this. You don't help misinformation by giving misinformation airtime. But I felt the opposite. I felt very strongly about that. The opposite. I felt like you have to talk about it. You have to say 5G is not the reason. Like, let's break that down. Let's understand why a microchip couldn't fit in the needle of a vaccine. Like, it's not possible. Let's talk about it, because the more you say it's not true and you don't give it airtime, the more it looks like you're trying to cover something up. And I think that the anti-vax machine, did a really good job of setting us up for having to defend ourselves. And instead of defending ourselves, we've been like, we don't have to defend ourselves. And I don't think that's true. I think that we do have to, and we have to do it in a better, more productive manner.
Yeah, I mean, RFK as Secretary of Health and Human Services is going to sort of put the anti-vax movement on steroids over the next 4 years, and we have to push back. And I think it has to be community education, right? A lot of people I know in my neighborhood, looking out my window, like in my neighborhood, are not reading medical journals. They're not reading, blogs. They're getting their stuff from their neighbors and their friends, and you know there's a long history of community health mobilization in the United States, the women's health movement, the Black Panthers health movement, the Young Lords, the LGBT community in ACT UP. Like we've done this before across communities. We know how to do it.
That's right.
And one thing we need to find is a big donor to bankroll us, like RFK has been bankrolled. But like we need an army of people around the country working in communities saying, it's not true about vaccines. This is how you protect yourself against COVID. This is what to think about H5N1, et cetera. We can't do it at a distance anymore. We have to do it face to face and with people in the places they live, work, and play.
Yeah, I agree with that. I think the big piece of that is humanizing science and scientists. I feel like a lot of times, even students that were pre-med, back when I taught undergrad, I think they just assumed that science was we asked questions, but we already knew the answer. It was kind of like just going through the steps to get to like a preconceived answer. And I don't think they understood it was creative and it's discovery. And we follow the truth. We follow what our results tell us, and then we ask more questions. And I think that humanizing that piece of science, and like you said, going out into the community, I think that is something that we absolutely need to do, and we need to mobilize scientists to get out of their labs, to take the time to
Get
do
out of
it.
the lab.
Yeah, I mean,
Labs
and
into the streets.
get into the streets. Well, I think, years and years ago that people were very invested in learning about science. And as we started to put science behind paywalls and we focused on all of our jargon, which, by the way, when you're a scientist, using jargon is much more efficient. It's concise. When you talk to your colleagues, saying the word antibody is much easier than me, giving like a paragraph explanation about what an antibody is. Unpacking terms is hard, but I think we need to start doing that again with the community to get them involved, and it can't be behind paywalls. I don't see myself as feeling like I'm elite. I don't feel like my colleagues feel that way, but I think that sometimes the community sees us as that way because of the jargon we use, and that we put all of our science in these behind paywalls, and also just barriers of the words that we use when we describe our science. So I think I agree with you. I think that's really important, and that's something I'm trying to have happen here in the Denver and Aurora area, but I think we need to do that all over, and we need all 2,500 people that are part of Defend Public Health to do that as well. So I guess to achieve the first.
Really
Oh, go
really
ahead.
quickly though, for the payroll, the not the paywall, the bankrolling issue. I think can we make a call to like Mark Cuban? He's on our side, right? Like, isn't Mark Cuban on our side? Like, should we tag him in this podcast? Like, or can we write him a letter from Defend Public Health or something? Because he's on our side.
Well, I mean, it's weird because actually I've had having this conversation this morning with people like, why can't we reach out to Melinda French, Gates, Mackenzie Scott, Mark Cuban, and others?
Exactly. Yeah.
I mean, Amy, for Defend Public Health, like you're on the communications committee, but why couldn't we organize all the SciComm people around the country who have podcasts, who are doing local community stuff, like to say like we're gonna federate and figure out how to do like something that has national scale, and then we can find money to do it. Because imagine the number of people who are doing SciComm in different sort of formats right now. Like imagine harnessing the power of them all together. It'd be very cool.
No, yeah, I agree. That would be awesome. And I think our next communications committee, I will definitely bring that up. The other thing that I was along these same lines with COVID, I think us, coming together and trying to have like an organized way, like a structured kind of organized way to do things would be incredibly beneficial for all of us across the country. Because one of the things that Tony and I talked about with COVID is it's not like every scientist across the nation every morning got together on Zoom and was like, okay, here are the talking points for this and for that and whatever. So I think trying to bring us together and organize to have some cohesiveness to what we're saying. I mean, I know we're all trying to do the right thing and say the right things, but having some kind of structure. I don't know, Greg, what do you what do you think about that?
The right wing had very good structure.
Yeah.
You know, COVID doesn't affect kids. It was a harmless virus. Really masks are bad. We are going to reach herd immunity by April. COVID vaccines are unsafe. They had a hit parade of lies and misinformation that they sort of hammered day out. I mean, maybe we should have a theme of the week. Maybe that we can ask everybody in Defend Public Health, but also on social media and other places to like, this is what we're hitting this week. And it doesn't necessarily have to be an advocacy message. It could be, do you know what's going on with measles in your community? There's just an outbreak in Texas. Let's talk about it. What does it mean? How can you protect yourself? How do you protect your kids? Do you know what's going on with H5N1? We could have a theme a week. I don't know. I do think you're right. We may not be sitting around thinking about what's the talking points today, but we could sort of, spend a week hammering at one issue and educating people in many different fora. So,
Yeah, no, I agree. And I think so years and years ago when I was teaching undergrads at CU Denver, I would do like a vax. This was like back in 2010. And, for about 10 years around that time, I would talk about vaccines, and we did a module where we looked at some of the anti-vaccine graphics and communications. And then we'd look at what the CDC and World Health Organization was putting out. And just from an aesthetic standpoint, we are boring. We are horrible. It's getting better. It's getting better. If you look at Unbiased Science and Jess Steyer, some of the stuff that she's putting out is absolutely amazing. It is, fun to look at. The graphics are starting. There are other groups as well, but we need to up our game when it comes to you know, getting stuff out there and making it, and this sounds silly, but making it look appealing, making it look exciting, making it accessible. Because I'll tell you what, back in 2010 and all that, their graphic game was, so much better. And we need to be, I think we need to pay as much attention to getting our science out to the general public and making it look good as we do to the figures, like the flow plots and the things we put in
Yeah,
our, journal articles.
we're thinking the same thing. Like I put out another call about 2 weeks ago. Like we need artists to help us, right? Like people who do graphic art, graphic design. And I was thinking the old ACT UP posters, but I still think like just for communications and like so again, like everybody, you may not be a scientist or a physician, but translating stuff into images and real language is a skill that most scientists don't have. So
Yeah.
and we could use help. So like calling all artists would be good. You know, again, when I was in Southern Africa, I mean, we did stuff in song, we did stuff in play. I mean, like we did, it wasn't just sort of visual or verbal too. It was, there's lots of ways to get messages across. We have
Yeah.
to use the culture industry to help us um, get science and public health information across in this perilous moment because the federal government's not going to do it now.
I know, and I think that's also key, bringing up that we need funding, and it needs to be not based on any federal funding.
No.
Like um,
That
small.
doesn't exist anymore at the point.
Yeah, no, I
Yeah.
know.
Hello. It's terrible.
I know. I know that whole
That is
thing.
that is gone right
Yeah.
now at the moment while there are lawsuits. It's still amazing. It is amazing that this was even that the way that the targeting of the funding for public health has just been
Oh, they're going after universities. They're going after
everything.
CDC. They know what they're doing.
Everything.
They want to shut us down, right?
Yeah, 100%.
Yeah. So like, the sad thing is that, the right wing has a lot of money and, Bezos and Zuckerberg are now in his pocket. Musk is in
Yep.
his pocket.
Yep.
So who are the good guys? Maybe it's Mark Cuban and Mackenzie Scott and Melinda
Right.
Gates, but like, where are they now? Where are
Yeah.
they now?
Yeah.
They're not stepping up at the current moment, and it's a shame.
Well, one
It's
thing that
actually really sad. It's actually really sad that we have to have a battle of the billionaires. Like honestly, like this, that's actually really tragic to me.
yeah.
You know?
Yeah.
I agree, and this is why talking about community education and community mobilizing is
Mhm.
important. But and it's weird. Like I think over the past 20 years, a lot of AIDS organizations got under the idea that if you couldn't do it if you couldn't pay for it. But like health movements and political movements and human rights movements weren't necessarily bankrolled by billionaires in the old days, right? Like it just was people powered and trying to figure out how to sort of ignite people power
We
around
need,
this is
we need to
yeah,
get back to people power. Absolutely.
yeah.
Absolutely. The money's not helping. The money's not
No,
helping.
no, and it constricts what people can do because foundations are also weird about like what they want you to say and what they let you do and what kind of products they like. So that again, the battle of the billionaires is probably not the way to go.
Well, one thing that I think has given me hope with this whole thing that I think a lot of these people don't understand is, and all three of us would I think completely agree. My PhD was the result of failure and fatigue. If you're trying to exhaust me, I exhaust myself. And I still survive. I thrive through exhaustion. I'm sorry, but game on. Like this is what we do for a living. If you thought that I'm just like in some cushy tower, making tons of money, sleeping 8 hours a night. Try again. Like this
Yeah,
is what we do.
yeah. I don't think they understand what. I mean, look, they've been organized. There's an op-ed in the New York Times today about the Christian right and you know how it organized for power over 40, 50 years, they may have woken the bear in terms of us fighting back. It's going to take a while to dig out. Like they've had 40, 50 years to build to this moment. Now we just got to get on our game. And you're right. Like a lot of us have worked hard in our careers, and now we have to work as hard to push back against this stuff. And then think of a better vision for the world, because like Trump will be gone one day, and what are we going to build out of its ashes, right? Like what do we do next?
Yeah,
Right.
that's right. I mean, I think that he's just the figurehead at the moment for the larger movement. And I hope they have woken the bear. I hope that people, maybe this had to happen in order for people to see where the gaps were. And so I'm here for it. Like I said, where's the resistance? Where do we join? How do we make it happen? And I think that the fact that many people didn't think that this was going to touch them, right? That is the bear poke, right? Because it's kind of like, oh no, I thought it was going to be these people over here that were going to be addressed, not us. We're not part of that. And now that they're seeing that it's blanket, it has nothing to do with picking and choosing and cherry picking. It has nothing to do with that. Now it's kind of like, okay, do you see what we were trying to protect you? And what we were trying to do. And granted, Amy and I talk about this a lot. The way we have been doing it has not been correct. 100%. The way that we have been doing it has needed an an upgrade, an update. 100%. We haven't moved with the times at all. We're like behind the eight ball when it comes to that type of progression. However, okay, now we are here. Let's go. Let's pull ourselves together. Let's stop hanging on to the past. Let's stop hanging on to the past, and now see what can we do to bring a better future. Like, what are the things that we can do to inspire everybody around us so that we can get this going, and making sure that people are not needlessly dying. It's one thing if you have a diagnosis and it is with because of your illness. This is unfortunately what is going to happen to you. This is the natural course of this illness, this condition, this disease. Okay, fine. But when it's a preventable thing, that's so heartbreaking. And that's what people don't understand, is that we are heartbroken as providers. We are heartbroken as scientists. We are heartbroken as public health advocates to see needless death, something that we could have prevented. And it's because of you misunderstood the way in which you were supposed to protect yourself, because we didn't do a good job translating it. Like, that is a heartbreak. And I think that we just have to kind of move with that compassion and emotion, and use this activation to kind of put that to the forefront.
Tony, I completely agree. One other thing that I would like to encourage people to do that I've been doing here in Colorado for about 10 years is we can go and talk in the community, and I think we should absolutely do that. But one of the ways to make a very large effect or change is policy. And one of the things that I do is the Colorado, every year, I will go testify in support of pro-science or pro-public health bills. I will also go and testify in opposition to bills that are going to weaken public health or are anti-science. So sadly, at least 2 to 3 times a year, I'm a voluntary unpaid board member for Immunize Colorado here, and I'm often called to panels as educator and immunologist. And I think one of the things that we need to do is to get involved in policy as well, because I will tell you that when I go to the state capitol, for every one person like me, there are probably 20 people that are on the other side that will, go and talk about how things are toxic or, things like that. And I think we need more of us to be actively engaged in actual policy and talking to our legislators, playing a role in drafting policy or being not consultants, but just, unpaid voluntary. I don't know, Greg, I think that's something we also need to add to this defend public health if it's not there, is getting people involved in advocacy in that way.
Yeah. I mean, before, just as Tony was talking, I was like, we need to show up, right? We need to show up. And, people can join Defend Public Health. Great. But, you don't have to join Defend Public Health. take your friend and go to the state capitol or to your city council and show up, right? If you're a scientist or a clinician, in your community, grab another one and go to the public library and tell them what's going on around vaccine preventable disease. I mean, we don't show up, right? We don't show up. So like for every one of us, there's 20 of them. We need to start showing up, and it can be under defend public health, it could be under indivisible, it could just be like the people you hang out with every day in the lab or in the clinic or at the public health department. You know what, we're going to go do something this weekend that makes a difference, whether it's the policy level or at the community level. We just have to show up, right?
I completely agree. I have about, I don't know, 30 colleagues in my department, and years ago, this is before the pandemic, I was like, you guys need to help me. I'm, the only one of us that's there. And I actually had a colleague of mine say, well, what do you mean? There can't be that many people that oppose what you're talking. I'm like, where have you been? Like every time I go, there are so many people. So Greg, I have a second degree black belt in Taekwondo, and one of the I did it with my kids years ago, and I just recently retired because I figured, I was looking around, it's me, with a bunch of teenagers, but when I walk down the hallway at the state capitol, I'm getting glares, there's like, and I'm like, you don't understand. I could surprise you if needed, but like I feel it actually makes me feel better, but it's there's so much opposition to scientists, for policy like that. And it's just it's sad that I think a lot of scientists don't understand how much they are needed to just show up to things like that. So yeah, I think this is would be a call to advocacy.
I mean, sometimes we don't incentivize it. Like you write your grants, you write your publications, right? You have to see this many patients, during a given day, et cetera. None of this is incentivized. And even in the current moment, like some department chairs and some deans and some university presidents are trying to keep their head low, right? Like they think like, it's not going to, the best way to get through this is to ignore it. Despite, the perverse incentives beforehand said it wasn't worth your while to go do any of this other kind of work. Um, you know, Michael Roth from Wesleyan University, the president there, had a nice op-ed in Slate this week and saying we can't be asleep at the wheel in universities and medical institutions, public health institutions. It's not going to work. Your silence is not going to protect you. And so, maybe this moment is where like you can walk down the hall now and say like, look, guys, we got to get to the state house and talk about these anti-vax bills because it's just going to be on steroids now, particularly with your governor like Jared Polis is a little bit, I don't even go there, but like, yeah.
No, I know. I saw that tweet immediately and was just a bunch of it was an immediate storm of like, what is happening?
Yeah. So, but yeah, but
Uh,
I think people feel under threat now in academia and in clinical research and et cetera. And I think maybe this is the moment where we can pull them out of their slumber and get them to show up.
Yeah, I think this is a turning point. We need to be, like the cicada that has slept for 17 years or longer. We need to emerge, all of us, from the soil and just take over in like just, large numbers, just like take over the environment. That's
Yeah.
that's how I envision it. We just need to all, there are so many of us. If we all join forces and we all actively engaged and played some role in getting ourselves out there, I think it would be unstoppable. I think it would be very inspirational.
Yeah. I mean, they're trying to depress us right now and make us feel powerless by all this crazy stuff they're like shock and awing us with over the past 3 weeks,
Flooding the zone.
flooding the zone. But like, we just have to say like, no, we are still coming for you. Brood X is emerging to
Yeah.
swarm your politicians' offices, and
Yeah.
anyway, I don't can't take the cicada metaphor a little any further than that.
I know. Well, I think thank you so much for your time. This has been awesome. I think this is really gonna hopefully engage some people and inspire some people to either join the Defend Public Health or just to start doing things in their own community or moving out of their lab and thinking about ways that they can engage. But is there anything that you'd like to add before we head out on this beautiful Sunday?
We have 6 inches of snow here, but I don't think it takes that many people, right? Like, you know, I was part of ACT UP in the 80s and 90s. I worked in South Africa with the Treatment Action Campaign. The persistence of a few people and the resourcefulness of a few people can make a lot of difference. Yes, we need to waken everybody up, but like if people realize that it's not, they don't need to be a million people strong to make a difference. I think it's really important to know. Again, like take your physician's office partner with you, take your lab mate with you, take your public health official with you. Just start doing stuff. Just two people, then build it, add more people to your network, and figure out how to do it. Like nobody shows up, right? And it's time to do that.
Yeah, I
That's great.
agree.
I love that.
Yeah, I agree. Well, thank you so much for your time. We really appreciate it.
Yeah,
We know it's
anytime,
Sunday
Thank
morning.
you.
anytime.
Great.
All right. I'm gonna